Yeah, so the way I typically tend to describe in sort of blunt terms is for a lot of women, breast cancer is menopause at the flick of a switch. So the technical term is medically induced menopause, whether it be from chemotherapy, which can induce temporary menopause or other drugs, or surgically induced menopause, which would be the case when a woman has their ovaries removed. About being very honing really specifically in on one area of the consequences, which is vaginal dryness, which is a really common complaint I hear from a lot of women. So dryness, itching, burning, chafing, or pain with intercourse, dryness with intercourse. Those are the really common symptoms. Because these dryness and those symptoms I mentioned earlier, they can cause pain, and it can also cause bladder urgency, so needing to pee more often, increase urinary tract infections, starting to cause some bladder leaks and incontinence. So symptomatically that can happen, but as well, pain comes with it. And with the pain can come increased muscle tone. Just think anywhere, if we've ever, injured something, we tend to guard and hold it. The pelvic floor is no different. So that can also contribute to these pain with intercourse, or the pelvis doesn't exist in a silo. So it can start to contribute to persistent hip problems, persistent low back problems. So it can be this sort of snowball effect beyond the actual direct impact of the estrogen loss to the pelvis. Because there's lots of things that can be done that you might not need somebody like me, which is why I want to talk about this. So the first one is hygiene. Take your bars of soap and your liquid soap and throw them away. Don't let them near your vulva and your vagina. Number 2 and 3, I guess, is the big topic of this is the use of moisturizers and lubricants. So I think a lot of us are familiar with what a lubricant is. So a lubricant typically is designed to be used for short-term use, to increase lubrication, to take away friction, so the vaginal tissues aren't less likely to be irritated. So typically we're talking about using this for intercourse, for pelvic exams, and if you're using any dildos, sex toys, any penetration of any sort, would be when we use a lubricant. A moisturizer, on the other hand, is designed for longer term use. Or longer lasting use, I should say. So just like you and I put cream on our bodies, at least if we do right now in Canada, it's dry and cold here, we're using moisturizer on our skin, the vulva and the vagina are no different. So remember I said that there's a lot of dryness with the postmenopause, and moisturizers are designed to give longer lasting moisture to those tissues. So they're very different products in terms of a lubricant will give you some moisture, but it's short lasting. It doesn't stay, it gets soaked into the tissues very quickly, whereas a moisturizer is designed to give you longer lasting moisture. What hyaluronic acid does is it helps to add, well, like we said, a lot more moisture into the tissues compared to something like a coconut oil, okay? And there are some really good products out there. There are some vulvar products, so where it's put externally, and there are some vaginal suppositories, either in sort of a tablet format or a capsule that has the cream in it. And then they are released into the vagina as it absorbs. So that is really the one that I recommend the most to this group of women, is the hyaluronic acids. They work quite well, and there's some good evidence to show that in some cases they're pretty close to the effectiveness of using an estrogen-based cream. Not all the studies say that, but there have been a couple that say that, okay? And then the last category gets a little bit more controversial. It is when we start to introduce an estrogen or a progesterone or a DHEA cream into the mix. And so those ones I can't prescribe. You would have to be going back to see your gynecologist in communication with your oncologist. And typically, at least in North America, we use that as a last line.